Hello everyone, I am Roslyn Juelais from BSN1 Henderson and I'm going to have a video presentation about skeletal system. And the first, we are going to palpating the surface anatomy of the lower limb, and the second one is the demonstrate the movements of the synovial joints.
The greater trochanter of the femur is a bony prominence on the upper part of the femur, serving as a site for muscle attachment, especially for muscles of the hip and thigh.
To locate this bony prominence, stand upright and place your hand on the side of your hip. Slide your fingers down the side of your thigh until you feel a bony prominence that sticks out slightly. This is the greater trochanter of the femur. You can palpate it by gently pressing your fingers on this bony area.
The patella, commonly known as the kneecap, is a small, flat triangular bone located in the front of the knee joint. It protects the knee and provides attachment for the quadriceps muscles. The tibial tuberosity is a raised area on the anterior and proximal near the top part of the tibia bone where the patellar ligament attaches. It's an important landmark for evaluating growth in children and is also a point of attachment for the patellar tendon. The lateral malleolus is a bony prominence on the outer side of the ankle joint formed by the lower end of the fibula bone. It helps provide stability to the ankle joint and serve as an attachment point for ligaments.
Similarly, the medial malleolus is the bony prominence on the inner side of the ankle. Locate the tibia bone on the inner side of your ankle and feel for a bony protrusion at its end. This is the medial malleolus. Palpate it by gently pressing around this bony area.
The calcaneus is the largest bone in the foot, forming the heel. It plays a crucial role in weight bearing and helps transmit forces from the body to the ground during walking, running, and standing. Flexion, a movement generally in the sagittal plane that decreases the angle of the joint and reduces the distance between the two bones. Flexion is typical of hinged joints, bending the knee or elbow, but is also common at ball and socket joints, bending forward at the hip.
Extension, a movement that increases the angle of a joint and the distance between two bones, or straightening the knee or elbow. Extension is the opposite of flexion. If extension is greater than 180 degrees, for example, bending the trunk or head backward, it is termed hyperextension. Abduction, movement of the limb away from the midline or median plane of the body, generally on the frontal plane, or the fanning movement of fingers or toes when they are spread apart. Adduction, movement of a limb toward the midline of the body. Adduction is the opposite of abduction. Rotation, movement of a bone around its longitudinal axis. Rotation, a common movement of ball and socket joints, also describes the movement of the atlas around the odontoid process of the axis. Circumduction, a combination of flexion, extension, abduction, and adduction, commonly observed in ball and socket joints like the shoulder. The proximal end of the limb remains stationary and the distal end moves in a circle. The limb as whole outlines a cone. A movement of the palm of the hand from an anterior or upward facing position to a posterior or downward facing position. This action moves the distal end of the radius across the ulna so that the two bones form an X. Supination, movement of the palm from a posterior position to an anterior position, the anatomical position. Supination is the opposite of pronation. During supination, the radius and ulna are parallel. Inversion, a movement that results in the medial turning of the sole of the foot. Eversion, a movement that results in the lateral turning of the sole of the foot, the opposite of inversion. Dorsiflexion, a movement of the ankle joint in a dorsal direction or standing on one's heels. Plantar flexion, a movement of the ankle joint in which the foot is flexed downward or standing on one's toes or pointing the toes.